We welcome you here to the Weber County Commission chambers. This is a work session on, I'll just identify this as Monday, the 30th of August. It's 11 o'clock in the morning. Present today is our Weber Morgan Health Department Director, Brian Cowan. Seated immediately to my right is Commissioner Scott Jenkins, and seated to my left is Commissioner Gage Frohr. We appreciate you being here. Inasmuch as this is a public meeting, it's not a public hearing, so no public comments will be taken. We recognize those of you who have chosen to be here in person, and we also recognize the many of you who are online. We're glad you're here. This meeting will consist of a discussion regarding the public health order. No formal decision will be made regarding this topic at this time, and this item may be addressed in a future commission meeting. If it is addressed at a future commission meeting, and those commission meetings are held on Tuesdays at 10 a.m., then because it would be on the agenda, then public comment would be accepted at that time. So, Brian, go ahead if you would, please.
Thank you, Commissioner, and I appreciate you getting me on your agenda so quick to have this discussion. I guess maybe to start off, we'll just jump right on the elephant in the room and to see where it takes us. I'm not here to inform the Commission that I intend to issue a declaration of a public health emergency, and as part of that, an order of restraint that would require masks in schools. That's not my intent today. I'm here at the direction and with the support of the Weber Morgan Board of Health to discuss a plan that takes a more targeted approach at addressing the COVID risk in schools. And as part of that plan, there may be a requirement to use masks when the school reaches a certain threshold of cases. And so I just want to take a few minutes to kind of talk about public health orders in Utah and what's happened over the last month as we've prepared for school to start in the state. Talk about our current situation here in Weber County with our COVID cases and our vaccination rates, and then also talk about the plan of what I would like to have on deck and ready to go if we see our case numbers expand and we feel like there's a high risk of COVID infections in our schools and the appropriate action to take there. Let me kind of step back a few weeks. It was about 3 weeks ago. The health officer of Salt Lake County Health Department, Dr. Angela Dunn, issued a declaration of a public health emergency and an order of restraint requiring mask use in elementary schools, kindergarten through 6th grade. And really, I think the intent there was to put in place a tool that's missing that helps mitigate risk in the schools, and that's the use of masks. The county council met a couple of days after her releasing that order and held a vote to rescind that order. And so it's no longer in place. And there is, that was done as a result of a Senate Bill 195, that passed the Utah legislature earlier in this year, which kind of further refined the authorities of a health officer in declaring a public health emergency. In that, it says that a health officer can declare an emergency, but a county governing body has the ability to cancel that order. It also requires that I give 24 notice of declaring that order to the Weber County Commission and the Morgan County Council. I really don't feel that we are an effective form of government if I'm forcing another group in the county, be it the county commission or one of the other departments, to play a hand. I really feel like we get work done better collaborating together, and that's part of my purpose here today, is to make sure we're having this discussion and putting together the best plan for response. Shortly after Salt Lake Council rescinded the health order in Salt Lake County, the Southeast Health Department and Grand County went through a similar process and enacted a mask requirement for kindergarten through 6th grade, their elementary schools, and that has stayed in place. So as they have started the school year, that local governing body, working with their health department, had determined that that's the best approach for them in their area. A week ago Saturday, Summit County issued a different declaration of a public health order and an order of restraint. And what was different about this one is rather than an umbrella approach that requires mask use in kindergarten through 6th grade, it ties in a little bit to the guidance given to us by Utah legislature with Senate Bill 107, which is the test, sorry, that might have been 105, the test to stay bill, which in the test to stay bill, if a school over 1,500 students reaches 2% of their population testing positive, then they enact a testing protocol, and a student has to have negative results to return back to school. What's missing in that legislation is the protective layer of mask use to try and control the outbreak. The intent of the legislation is to stop an outbreak before it gets out of hand. Using masks as a tool to further help prevent that, I feel, is a good approach. And that's what Summit County has enacted. Now, their order is in place today. So as their students are attending school at the beginning of the school year, they're monitoring cases, and the students aren't wearing masks. But if they have any of their schools approach that or hit that 2% threshold, then mask use goes into place. This order is good for 30 days, and then they have the ability to renew that, working with their county government in the process. As the Board of Health held their meeting last Monday, there was good discussion about mask requirements in schools and what the appropriate approach should be for public health. There was a motion made to require masks and a discussion held. And as a result of that discussion, that motion pulled back. And then further discussion and a motion made by the Board of Health, which is the direction that has me here today, is to approach the Commission with this plan of looking at what Summit County has done as towards their approach for using masks in schools, but also tailoring it a little bit closer to what we feel is a benefit to us in our schools in Weber and Morgan counties. I think as I approach this order and look at it, I feel like it's something I'd like to keep kind of at the ready for the day when we have a school reach that 2% threshold and then enact it. As we watch case numbers, we have some concerns, and I'll address those in a minute. But I think that would even be a more focused approach by waiting to enact it than initiating it today and hoping that we catch what we catch in the next 30 days. So that's kind of the background that has gotten me here today. I met with Morgan County Commission on Wednesday evening and had a very good discussion about this issue. Very similar to what I'm bringing to you today. I wanted to talk about our current case numbers and do a little bit of a comparison to where we were last year as the school year started. Today in Weber Morgan Health District, we've had a total of 36,338 positive COVID cases reported, and that goes back to February of 2020. Active cases, defined as people that have tested positive in the last 14 days, we currently have 1,995 active cases, which is about more than three times the number of active cases we had in August of 2020, a year ago. Last year, on this date, we had 518 active cases. So there's quite a bit more transmission today than we saw a year ago. If we break that down a little farther to the age demographic that we're concerned about in schools, now our school age kids are 5 to 18 years old, but vaccinations are available for the 12 to 18 year olds, and that's really the most effective preventative measure. But the 5 to 12-year-olds, we've not received emergency use authorization for vaccinating them yet. So they're the most vulnerable in our population currently. And the next effective tool is mask use for that age group. Currently in Weber County, we have 189 active cases in that age demographic. In Morgan County, they have 11 today.
Well, when you say age demographic?
5 to 12. 5 years old to 12, or kindergarten through 6th grade.
Brian?
Yeah.
How many total in that population?
I do not. Sorry, Commissioner. I think you're asking me that how many 5 to 12-year-olds are there in Weber County? Is that correct?
Right. How many,
yeah.
So of those 189, what was the population you used to calculate?
I'm sorry, I don't have that statistic with me, but I can get that for you. Let's see. Last year, so as we look at these numbers, we're anticipating starting the school year in Weber County, the Ogden School District and the Weber School District, with 189 active cases. And as I look back to the active cases that we had when we started the school year a year ago, for the whole month of September, we had 27 cases. And then the whole month of October, we had 108 cases. In November, 171, and then our peak month for the end of 2020 was December. That's 228 active cases in that month. So you can see with the numbers we're starting this school year with, there is a concern that there's more coronavirus present in that age demographic. Last August, we did have a mask mandate in place for the entire population, which is not in place today. But we do have the vaccinations available, which is a more effective means of preventing infection or reducing the risk of infection. But it's still not available for those 5 to 12-year-olds. Those are the things we're considering. And as we put these numbers into some of our predictive models, we have ways to kind of estimate the preventive layer of vaccinations and the uptake in our community with vaccinations and how that benefits. And we also have the ability to kind of model after with mask use in place versus no mask use, or a combination of that. But in kind of what we've narrowed it down to as we look at these predictive models is if we stay on the current path we're on today, we anticipate that our schools will reach that 2% threshold, the test to stay threshold, sometime in the next 6 weeks. We think we'll have some schools that approach it faster than that. But overall, as we look at the entire school-age population, and this would include the entire demographic from 5 to 18 years old, we're anticipating that sometime by the first to middle of October, most of our schools will be at a test-to-stay protocol. Another thing that concerns us about our current situation with active cases is the hospitalization usage and the number of deaths that we've had from COVID. Let me talk about the hospitals first. Currently, in Weber County, we have 2 hospitals, McCady Hospital and Ogden Regional. And as we look at the state dashboard, so the hospitals report to the state of Utah what their capacity is, their intensive care unit capacity, number of beds. This data would have been Friday, not an opportunity for it to be updated yet this morning, but on Friday they reported 35 ICU beds being utilized out of 30 available, which is 116% of the capacity for their incident care units. In their non-incident care unit beds, for Weber County, we're reporting 296 beds in use out of 455 available, so 65% of the capacity. And we look.
State total?
No, this is in Weber County, our 2 hospitals. Yeah.
Well, can you start over those again?
Sure.
Start at those.
The dashboard this morning is showing for ICU beds, 35 out of 30, which is 116% of capacity. Non-ICU beds, 296 out of 455 available, which is 65% of capacity. And then we also track the number of ventilators available in our county. We're reporting 35 in use out of 102 available, which is 34%. But what we're hearing from our hospitals is that this rate of ICU utilization is not sustainable. And statewide, we're also seeing that issue, with the statewide reporting 85% of ICU beds being utilized.
Brian, can I ask you a question? So out of the 35 ICU beds and the 296 other beds, how many of those are related to COVID versus other type of treatment?
I don't have a breakdown of that. I apologize, Commissioner.
I'm sorry, can you say that again, please?
Sure. I don't have a breakdown of how many beds are COVID-related versus non-COVID related. And I can appreciate asking that statistic, and apologize for not having it available.
Is that something you could come up with, or?
Yes, we can investigate that.
I think that's a fairly important number to have.
It is important, but the bottom line
I
is...
understand where you're headed with the number of beds, but I'd like to get a feel for, you know, is the saturation because of COVID, or is it because of other?
Yes, I will follow up with the commission with
Brian, I got a
that
question.
number.
How many of those who are in ICU, of the 35 that are currently in ICU, or the 296, do you have a breakdown by any chance of how many of those are vaccinated or were not vaccinated?
I apologize again, I didn't bring that statistic with
Okay.
me, but we can look into that.
I've just heard that most of the people today who are hospitalized, or especially that are in ICU, are one between a particular demographic, 30 to 40-ish, 25 to 40, and then the other one is that the majority are over 90%, and I don't know if that's, or have never been vaccinated, or have chosen not to be vaccinated.
Yeah, we are well over 90% of the hospitalizations are in non-vaccinated people, and the deaths, well over 90% of the deaths are in non-vaccinated individuals.
That's good enough for me. Thank you.
There are a small number of breakthrough cases in vaccinations, but it's being demonstrated that the infection is much less severe in a vaccinated person. I guess finally, maybe the last COVID case statistic just to share with you. In the Weber Morgan Health District, we've had 254 COVID-related deaths. 243 of those are in Weber County, and 11 of those have been in Morgan County. If we break down the age demographic of those deaths, and this is really an important issue to keep in mind as we discuss what are the best tools to use to reduce risk in our schools. Less than 1 year old in the state and in Weber Morgan County, there have been 0 COVID-related deaths. In the 1 to 14-year-old age demographic for the state, there's been 1 death. In Weber Morgan Health District, there's been 0. In the 15 to 24 age demographic, statewide, there's been 10 deaths. In Weber Morgan, there's 1. For the 25 to 44 age demographic, statewide, there's been 129 deaths. In Weber Morgan, it's 14. 45 to 64, there's been 550 deaths. 62 of those are in Weber Morgan Health District. 65 to 84, statewide, 1,265 deaths. In Weber Morgan Health District, 120. And the 85 and older demographic, statewide 673. In our health district, 57 deaths. Looking at those demographics, it's easy to see that this disease has a greater impact on people as they age. But it's not safe or a good mitigation practice to look at these numbers and say that because there are lower deaths in younger age individuals in our population, that there isn't a risk to them. There's still a risk present. And we still need tools in place to help mitigate that risk. Now, as we look at this, the tools we have to help mitigate that risk, for 12-year-old and older, vaccinations are our most effective tool. And we've been diligent at the health department in administering those vaccinations and also working with partners in our community to make them available. We have over 40 partners administering vaccinations in Weber County right now, and that includes pharmacies and health clinics, hospitals, as well as the health department. We've had really good uptake of vaccinations in the older demographics. Just to share some percentages with you, older than 70 years, 91% of our population is vaccinated. 60 to 69 years, 83% is vaccinated, and 50 to 59, 70%. Though 70%, as we initiated vaccine distribution, was our target. That's where we wanted to get. And older than 50, we're there. Where we're struggling and seeing reduced uptake is in the younger demographics. 40 to 49-year-olds, 64%. 30 to 39 years, 52%, 19 to 29, 51%, and 12 to 18-year-olds is 49%. Now these are, make sure I clarify this, these are people in our Weber and Morgan Health District that have received at least one dose of the vaccination. We're seeing slight growth in some of, from week to week, in some of these younger age demographics. The 30 to 39-year-olds, 1.7% increase in growth over the last week, and that's been pretty steady at that percentage, give or take a couple of points, 1.5 to or so. The 12 to 18-year-olds, we've had a more steady growth, which really is what we need as we start the school year in that age group. 2.7% of growth from last week to this week. And really that's what a lot of our efforts are in schools right now, is trying to encourage parents to get their students vaccinated for them to attend the school year this year. And we've been working with the school districts to hold after-school events or other vaccine events to try and make them available to parents so that they can take advantage of that. When we look at the percentage of all eligible ages, that's everyone older than 12, Weber County comes in at 64.3%. For the state, it comes in at 51%. So, sorry, let me restate that. I read this wrong. I don't have the state statistic here, apologize. 64% for eligible, older than 12, 51% for all ages in the county. So that adds the younger than 12 into that demographic. For the state, and I'm pulling this from memory, but I believe we're around 53% statewide. So our health district's a little lower than the state percentage, but we're doing everything we can to try and get that number up. So that kind of just gives you an update on where we're at vaccination-wise. Just kind of a new thing that's developed over the last couple of weeks for us with vaccinations is the approval of a third dose vaccination for the immunocompromised. We've been administering those for the last 2 weeks. And as we are preparing to have larger scale vaccination events available to our population when the approval comes through for third doses to all community members. We anticipate that to happen sometime in mid to late September. And then our events won't be as large scale as they were at the D Event Center, but we do plan on increasing availability to help those people that are interested in getting that third dose.
There's Isn't there a 7 or 8 month waiting period between the second and third?
8 month,
8
yes. 8 month is the current recommendation between the second and the third dose. Okay, so we've been busy the last month preparing for the school year to start. We've put a lot of tools in place to help mitigate risk at the schools. And I want to talk about this just for a minute because as we've received input from the public at the health department, we've been positioned in between parents who ultimately want the same thing. They want a safe, healthy, good learning environment for their students. Where we've started to diverge is in the decisions being made of what creates that safe, risk-free, or managed risk environment for those students. A lot of parents feel like, or at least the impression I get from the comments we receive, that masks are the only tool that's available to mitigate risk to their students. And I just want to share with you that that's not the case. For the older students, the older than 12, vaccinations is the most effective tool and it's available for them. For the elementary age students, the next most effective tool is case investigation, contact tracing, and then isolation and quarantine. We've hired a team of 15 employees whose focus is managing those things for this school year. Working.
So, Brian, let me interrupt you there. So you said isolation and quarantine was the second one. So last year, we actually made a real run at documenting everybody who had this and isolating them and quarantining them.
Yes.
Is that your intention this year, Jim?
Yes. So let me explain that, Commissioner. Isolation applies to a person who has tested positive, and that's when we ask them to stay home, not go to work or go to school for a 10-day period. And quarantine is what applies to people that have come into contact with that positive case. And in the last year, we gave them the same guidance: stay home for 14 days. If you're symptomatic, get tested, and then if they tested positive, we'd initiate the isolation criteria.
So the testing between last year and this year got much better, right? Now we can do 15-minute tests, can't we?
We can. There are rapid tests available.
Rapid tests.
That we'll be utilizing in the schools this year. We've also changed.
We had that rapid test, those commissioners. I forget where we were at. We were somewhere and they applied that, and it seemed to work. It was not invasive at all. Right on. Yeah, no big deal.
Yeah. Quarantine at the school has been changed a little bit from what we experienced last year. The priority that we have, the school districts, our elected officials, the officials at the health departments, the other local health officers, we want kids in school just as much as anyone else. We feel like that's where the best learning occurs, and it's less stressful for the faculty and the staff to have them there present. And so as we make decisions, that's our number one priority, is how do we do this safely and keep kids in school. So with that in mind, quarantine for a school exposure has been adjusted. And instead of, if we have a positive student at the school and they interact with their classmates, instead of, like last year, if we told them to quarantine, those classmates stayed home. This year, the parents have 4 options of how they can approach quarantine with their student. The first is they can keep the student home for 10 days. The second is they can keep the student home for 7 days, do a rapid test on the 7th day, and if they get a negative result, the student can return to school. The third option is they can send the student to school wearing a mask for 10 days, and the student has to keep the mask on while they're at school. The fourth option is they can send the student to school masked for 7 days. On the 7th day, do a rapid test. If the test result comes back negative, then the student can stop wearing the mask. So that's how we're approaching isolation and quarantine with our school population this year. The staff we've hired at the health department is working closely with the school districts to make sure that we're doing the case investigation and contact tracing at the most efficient level we can. Case investigation is when we're notified of the positive test. Contact tracing is when we do the outreach to everyone that was identified as a contact to this person, letting them know of their exposure and then asking them to take the steps under quarantine that have been outlined for this school year. With the staff we have trained and doing this work, we feel like we're responding and getting this outreach done within 24 hours of notification of that positive test. Where this system, it's a strong system at risk mitigation, but where it starts to break down is when we start to lose cooperation with the person that's been identified to isolate or the people that have been identified to quarantine. So we're really emphasizing to parents this year in schools the need for them to cooperate with isolation and quarantine to make these tools mitigate the risk that they're intended to. I mentioned the Senate bill earlier, the test to stay protocol that kicks in at 2%. If it's a school over 1,500 students, the threshold is 2%. If it's a smaller school, less than 1,500 students, then it's 30 students. If they have 30 students test positive, we go into the test to stay protocol. That test to stay identifies positive cases, whether they're symptomatic or not, and then puts them on isolation and pulls them out of the population. But it's resource intensive. We have a team built at the health department to be able to respond to about one school a day, maybe two, with staff we have available. The state health department has built a team of 9 mobile testing teams that can go out and help the schools in this testing protocol, and then the schools themselves have had developed the way to conduct this testing if they reach this threshold. There's some weaknesses in the process, and mask use would help overcome some of those weaknesses. If we initiated mask use when the school reached the threshold of cases, we'd then add that extra layer of protection while we work through the testing, identifying the students that are positive, the isolation and the quarantine to try and stop an outbreak at this school in its tracks. And really, I think that kind of gets me to where I wanted to land with this meeting today, and that is to take the opportunity to explain to you everything we're doing at the health department to try and mitigate this, but also ask you to consider. Just this isn't approval today and consideration. This is, I want you to think about it and have the discussion as you identify things like we've already identified today, more information that you need to help you with a decision or more input that you'd like to gather before we move forward. But I think our plan today at the health department is to have on ready a declaration of a public health emergency. Should we find through monitoring these cases at the schools that we reach that 2% threshold that requires test to stay, and that our capability at the health department becomes overwhelmed. Included in that is going to be monitoring the hospitals and their ability to keep up with the current infection rate in our area. So if that day approaches, then I will be back to let the commission know that my intention is to declare that public health emergency, and the pathway I'd like to follow is something very similar to what Summit County has done with their order, because it's more targeted intervention and affects a smaller number of people that would be required to wear masks. But the essence of the order would be that we require mask use in schools that have reached that threshold of 2%. These would be the elementary age schools, the junior high school, they can get vaccinated, and they should. So I really want to keep this order focused on where it will have the largest benefit, which is the elementary age school, and that we would require mask use for a 14-day period after reaching that threshold in the school to try and reduce the spread of COVID in that facility. And as I just want to reemphasize, this is a plan. It may adjust as we learn more and see how the plan works in other areas. We are also, the Local Health Officers Association is also looking at other things that we could do rather than requiring mask use to help mitigate this risk. One health department is considering changing the threshold from for test to stay from 2% down to 1%, but just in a classroom level, not the entire school. That's something we need to explore and see how that would benefit us in our area. So as I kind of share this plan with you today, I also just want to share that it may change. As we learn, we look for solutions, share new ideas with each other in the state on how to approach this. I may come back with something a little bit different than what we're talking about now. But that's really kind of it, where we're at the moment. It's a plan. We want to be ready to go. We recognize it's more reactive than it is proactive, and there's a lot of people in the community that would like us to take a more proactive approach. But I think part of my role is to work closely with you guys, the elected officials here, and also in Morgan County, and make sure we're making decisions that are best for the community. So even though I may feel that from a public health perspective, there might be a better, I shouldn't use the word better, another direction I would like to pursue, I recognize that we need to collaborate and work together and find the best solution for our county. And that's the approach I'd like to take.
Mr. Cowan, thank you so much for that report. You and your team have done a wonderful job, and we appreciate the work and especially all the information that you've given us here today. That's a lot of information, and I know that you've exercised a lot of, personally, a lot of thought and effort going into this today, and I appreciate that very much. Commissioner Frohr, I'm going to turn to you for questions first, in as much as this is in your portfolio. For any questions for Mr. Cowan?
Thank you, Mr. Chair. A comment first, if I might. I appreciate Mr. Cowan's work on this issue. I was at the Board of Health meeting. This was discussed last week, and we heard from two opposing community efforts here in Weber County, one that was very much in support of mask mandate, the other that was very much opposed. At the end of the day, they agreed to disagree, but I think we came away with a common understanding that what we all want is those kids in school. And I don't think either of those parties, either of those factions, would disagree that we want the kids in school. I think what we disagree on, or what was disagreed at that meeting, was the best options to make that happen. I've got a couple questions, if I might, Mr. Cowan. So first off, with the Summit County effort they're putting forth with the 2%, do we have any results? Are we showing any results from that yet in terms of are masks now being required in more schools, or is it the same? Or do we know?
I don't know, Commissioner, but I can follow up on that. I wouldn't expect that there would be much information yet, since their school year just started last week.
And they're not,
they're not
emergency order, the public health emergency order has not yet been issued, or they haven't yet reached that threshold of 2%.
Yeah, the order has been issued, but they haven't they haven't reached the 2% threshold in any of their schools that I'm aware of.
Understand. Thank you.
And I appreciate your efforts when you're saying you're looking at options. The first thing that came to my mind on this 2%, number one, where did the 2% come from? Is 1% the numbers? It should be 5%. I would like to have a better understanding of really how that relates. And if I heard you right, I understand for those schools below 1,500, it comes down to 30 cases, not 2%.
Yeah.
Is that correct?
It is. The 2% comes right out of the Senate Bill 107, which is the test to stay bill. That's the threshold that the Utah State Legislature established for that for test to stay protocols to go into place. So it's our starting point. There's a lot of discussion to be had about maybe a lower threshold to help prevent the school having to go to the test to stay protocol. And that's something I feel like we still need to explore with our superintendents.
And well, that was leads to my next question. What are the schools in support of any particular program at this point in time? Have the school districts expressed any information to you that would say, look, we should do 2%, we should keep our hands off of this? What's their stance at this point in time?
It depends on the school district and their superintendent. We meet with them and have these discussions on a regular basis as we've helped them prepare. Really what I hear from all three superintendents is they just want a direction to go and to be able to follow that. They don't want to be positioned in a political will battle.
Right.
So as we have the discussion with the superintendents, I think really what I get from those discussions is that they want to find a solution. They want to work together to get to that, but they just want the guidance from us on what they need to do at their schools. As we've looked at the 2% threshold, as I've discussed that with the superintendent, Luke Rasmussen, we feel like the 2% threshold is good for the larger schools. The 30, if we just stayed with 2% for the smaller schools, that might not be an adequate number, because we could have, if it's a small school with 300 in the student body, for example, and we had three positive cases in the same family, that would put them well over their 2% and kick the school into a test to stay protocol. So we would like, but 30 might be too many cases. So we would like to explore what's the right number or threshold somewhere in that range, where we don't have just a household cause a whole school to go into a test to stay protocol, but we also have a number of non-related cases. Maybe that's approach we'll take that would help us initiate mask use and eliminate the test to stay protocol.
Yeah, and I would encourage you to look at that. I mean, I look at the Valley Elementary up there, what, 350 or so students. You could have 5 or 6 cases that would shut down the entire school, and that could all come out of one classroom. So I liked your looking at options that maybe we bring this down to a classroom size rather than a school size, and that goes back to your contact tracing. But I think this needs some more analysis. I mean, obviously, as I stated before, this needs to be a data-driven decision. It looks like you're headed that way, but I think we need more information. I would also appreciate the information on the ICU beds that I mentioned. I think that becomes, and I hear from members of the public quite a bit that they've going in for surgery and there's no beds available. And I'd like to know exactly what impact this is having. And then obviously the overall answer to this, I think, is an easy one: get vaccinated. Now, how we get there, and I'm not placing any blame. You guys have done a great job, but there's people out there that don't see the value in it, that I think are impacting their neighbors and friends and family because they make that decision. And whatever we can do to encourage them to, if they don't want to do it for themselves, do it for somebody else. Thanks. That's my comments. Questions, Mr. Chair.
Thank you. Commissioner Jenkins?
All right, Brian, I've got several questions. When you talk about trying to get ahead of this, first of all, when you talk about a school of 300 at 2%, that'd be 6. So one family or 2 families good. So rapid testing, is it reasonable to even consider testing everybody in a school once a week, like every Monday morning or something like that? Are those tests expensive? Is that way? Is that a wild, crazy thought, or is that, what is that?
Well, that's an interesting question you've asked.
Well, the reason I say that is when we had that test, I didn't have to stick one of those things to my brain. It was just a little moisture right there, and it was pretty simple. Yeah. And it seemed like from the time we took it to when it was done, it was less than 15 minutes, like 10 or 12 or something like that. Is that even a thought?
Yeah, we've given this a lot of thought, and I think the weakest area of the test to stay requirements is the logistics of actually getting it done. There is some limitation on the availability of rapid tests, but we have a good supply in the state. So we feel like starting the school year statewide, there's enough that as schools start to approach that threshold, we can react and the testing is available. The state health department and the local health departments have ramped up their ability to go mobile and conduct those tests. Some have more capability than others. We're a little bit limited in WEBER Morgan, but there's also some private partners that can help us with that, and the school districts themselves also have had tests available to them. They can train staff or volunteers to conduct those tests as well. And affordability-wise, there's been a lot of money that has come into the state health department and to the local health departments to help purchase those tests. The schools have also received funding to help purchase those tests. So I think, for where we're at today and starting the school year, we're stocked up, ready to go, and can start doing those tests. The unknown is, how fast this is going to happen. We're starting the school year, as I mentioned earlier, over 3 times the cases that we started the school with last year. And last year we had mask requirements in place for the entire population. This year we're missing that.
So you didn't really answer the question. We probably have 20,000 students in the county. Is it realistic to administer 20,000 rapid tests every Monday morning?
No, we cannot. Okay. We don't have the capability to do that.
That's the answer I wanted to hear. All right. Secondly, I've had a lot of these folks that are in front of us today present us with these boxes with that mask right there that you have, and it says right on there that mask doesn't help for a virus. So I understand the push and the fact that a lot of these folks don't want their, especially kindergarten children, in these masks all day long. And frankly, I had this discussion last night with my daughter about my youngest granddaughter and that very issue, the fact that it's so hard on them to focus on their work when they have this mask on all the time. And so is there any more current studies that are out that show it is effective or isn't effective? I listened to a deal the other day, and they talked about really the person that should be masked is the sick person, not the healthy person. That's where the mask would help. That the healthy person that doesn't, is that true or not? Is that bunk?
There's Commissioner, there's a lot in that discussion, and if I can just kind of boil it down quickly, we don't have any one tool in our risk mitigation toolbox that's 100% effective. So it's easy to look at the mask label and say this isn't going to work because of warnings or other criteria that might be on the mask label. There is a lot of research that's looked at the efficacy of masks as a risk reduction tool. And there's benefits that are demonstrated if a sick person wears the mask and a reduction of virus-containing droplets that leave through that mask material. It's not 100%. It's not going to stop them all, but it does reduce it down by a percentage. There's also been a demonstrated risk reduction measure for healthy people to wear a mask in reducing their risk to COVID, because then some of the air that they're breathing in is filtered, and if there's droplets containing the virus in that air, there's potential for those droplets to be removed and reduce the risk to the healthy person. And there's a combined benefit if both, an even higher percentage of risk reduction.
So to that statement of droplets, if the 4 of us are sitting here in the room talking, we're all healthy, no issue. If you end up being sick, the droplets you're referring to is moisture that comes out of you, and the heavy moisture comes when you sneeze or cough or something like that. So that's when that mask would be most effective.
Yes, coughing, sneezing definitely puts out more aerosols in
everyday
variation
breath.
into size. Well, in our everyday breath,
very
we
much.
still put out
Still
aerosols.
moisture.
Yeah, still
But small.
smaller amounts.
Okay. You know, this is so hard to make a decision. And I understand why parents are saying they want to make their own decisions because, you know, you hear the national news and you hear the discussion going on there, and then a matter of the next morning, you hear some of the local news, and they don't coincide. The feelings, the science, I guess I should say, when they say, well, let's follow the science. Well, that'd be pretty easy. I'd love to follow the science. But I don't get a feeling that the science is uniform. Not everybody agrees on it. And that's the part of this that upsets me so bad. It's like, look, science is science. I understand that. It should be pretty, you know, you ought to be able to look at something and say, well, look, 98% this is right. But when it comes to masks and the use of masks and the virus control of it, it's all over the board right now. And I don't even know what to say. It bothers me so bad because I'd like to come down on this, on the science side, say, look, this is what we got to do. And frankly, on the vaccine, even though I don't love the idea of all of us being vaccinated, there is science to show that that's the best way to go. And man, we all got vaccinated for polio and all these others.
Bella.
Yeah, and so there is some science there. And so I feel much more comfortable about that, especially for the ones 25 and older, because the numbers dictate that, and these are Utah numbers. These aren't numbers nationally. I look at this, and those are Utah numbers. And so I say, okay, look, people 25 and over really should make an effort to do this. So let me, over the weekend, Thursday, I have some people I'm associated with, and their son brought COVID home. And of course, he was a younger gentleman, and I guess this goes to your load capacity they talk about, and how it affects some people and others it doesn't. Mm-hmm. And anyway, it didn't really bother him so much. Well, his parents got that, and by Friday, they were both feeling terrible. They called the ambulance. They came out and got him. And when you talk about what's in a local hospital, he went up to the McKay-D and they couldn't take him. So they sent him to Bountiful. I was like, really? Bountiful? And they said, well, it's the only place there's an ICU bed. So he went to Bountiful, and by noon Saturday, he was on a ventilator. I was like, wow. Did that, I mean, that wasn't even 48 hours. That happened so fast. And he's struggling for his life right now. And I look at this and I just shake at this whole thing. But I'm telling you, by the numbers, those certainly 45 and over are nuts if they don't get vaccinated. And the 25 to 44s, they really should. Okay, well, I guess I've asked you the questions. Those were the two that I really wanted to ask.
Great. I appreciate what you've said here today. Mike, if something were to be put into place, a declaration of public emergency, like in the case of Summit County, if they reach that threshold, who polices that mask in the school?
That falls to the school, the local education authority.
So the principal or the teacher?
Right. Mm-hmm.
Or the reserve officer or the officer who's at the school? Okay, that helps me as well. You know, I remember my whole life since I was a boy, there are things that I've used, whether it's been on a motorcycle. I use a helmet sometimes, not all the time, to mitigate risk in case I fall. I use an airbag every day. I turn the car switch on to mitigate in case I get into an accident. There are mitigation devices everywhere we go, and I think masks are another form of to mitigate health. Whether how they're 100% effective or not is not the question. I do believe that they mitigate the spread. That's just, but so does, that in the examples I mentioned after is my point. Commissioners, do you want to, any more discussion regarding this? I don't have any more questions myself. It's been a lot of, I would like some of the other information that we have now. I'm looking to find numbers with the schools. I did the quick math as you were making your presentation, Mr. Cowan, and I think the number 30 students you brought up twice, 30 students at 2% at 1,500. When you get it to some of our schools, like Commissioner Jenkins mentioned, or Commissioner Forer mentioned Valley Elementary, some of those with lesser students, you know, it's 2%. But then I heard you say if less than 1,500 students, the number is still 30 students. And so that would be almost 10% if you had 300 students. And so is the percentage the right way to go? Boy, there's a lot to think about here, a lot to digest in that order there. I would also, I've been vaccinated. I think I have, with my current health, I have more chance of having other health issues than probably a negative effect from COVID, but I'm glad with the science and research that I've seen, those who, if you get COVID again, since you were vaccinated, your chance of succumbing to is much less than if you've never been vaccinated. Scott, like your friend, who's fighting for his life right now, chose never to be vaccinated, and probably in the higher age group, but
just a couple years younger than me, so it'll be 60, early 60s.
So vaccinations, I think, are our best option right now. And if anything, if there was a message that I would get out right now, is to please be vaccinated. It's too late once you get the COVID, and how you react is another thing. Well, if any other questions or anything, Brian?
Not a question, but a comment, Mr.
Please,
Chair. So
please.
I think, so this was a good informational session we had. I would suggest that maybe we do a weekly update with Mr. Cowan, or at his discretion. I think this is obviously a moving target. I don't think we can just leave it here and then wait for whatever may come down the road. I'd like to set up, whether it's in our work session every Monday, we do a 10 or 15 minute phone call, or if the numbers, but I'd like to have this on a regular look so that we know beforehand, we don't hear 2 weeks later that, hey, we do have, all of a sudden we've got a major medical emergency here, if that'd be right with you, Mr. Chair. You set the agenda. Just like we did during COVID, we held weekly Friday meetings, and not that we have to involve the mayors, but I think for the four of us would be informational to just know where we stand.
Well, one of the things that through this whole process that I have appreciated for the health department was that meeting, Mr. Forer, that you did on every week, and that let the community leaders know, and the public, of course, was invited to participate electronically via Zoom. I don't have an issue with that, with that weekly meeting, but Mr. Cowan, what would you be available, and would Mondays be good for you, or like we did before, a Friday? I know you get information on particular days from the state. What are you thinking?
I would love to give you a weekly update, and if I'm not available, we'll make sure someone else on our staff is. The state has stopped updating their database over the weekend. So Mondays can be a little bit slower in us getting the most up-to-date information. So some of the numbers I shared with you today are what was reported on Friday, for example. So I'm happy to do it on Mondays as part of the work meeting, or if you'd like more timely numbers, another day during the week would be I could get you some more timely numbers that way.
I think what I'd like to do, based on what you've just said regarding that, is to set that, I know that we have regularly scheduled meetings before our weekly commission meeting. Please know that state law requires us to notice anytime we place something on a commission agenda or in a public hearing, a 24-hour notice. And so even this meeting, if we were to notice it for tomorrow, we wouldn't be able to do that. We'd have to meet on Wednesday or later tomorrow afternoon if something were to happen. We do meet regularly Tuesdays at 10 a.m. I'm wondering if we were to meet right after that commission meeting, but that's kind of floating, so if people were interested, maybe about 9:15, would that interfere? I know I've got weekly meetings.
Monday?
On Tuesdays, sorry, thank you. I know you meet with your divisions, and you meet with your divisions, and I meet with mine on Tuesdays earlier at 8. But I'm likely could do, a 15, 20-minute
Well,
update.
Monday's not possible.
But I can do it on Monday.
Well, that'd be okay, but he said sometimes the information is slow, and
Yep.
next week, Monday, is a holiday.
Well, the only reason I say Monday is because at the public meeting, we Zoom it, and all these folks that wanted to keep up with what we're doing could get that information, and it'd be hot off the press. It would be as fresh as any information they could get.
Would you like to, then, should we do that each Monday?
If we put him at the end of our meeting at 3:30, 4 o'clock?
Does that give you enough time to get the
Yes.
information from the
Yep.
state?
Yep.
Let's just make that a standing meeting. Let's do that each week so that you can, I know you have some board meetings to do at 4 o'clock. And so let's, with 3:30,
3:30 works great for me.
So we'll
Or
meet-
when, we could adjust that based on the schedule.
let's try 3:30, Christie. 3:30 is on Monday, so every week in our work session, except for today, 3:30. Now, we've got one, I'd like, with the exception, sorry to get down into the weeds here, but I'd like to go, where we won't be meeting next week, Monday. So I'd like to meet next week, Tuesday, so that we are consistent. And commissioners, are you available next week, Tuesday at 3:30?
Let me look.
Mr. Cowan, are you available next week, Tuesday?
I can be available. Yes, sir.
So we'll meet on Mondays at 3:30, except for next week, which will be Tuesday at 3:30. You'll likely get your information. Does the state work on that holiday? Labor Day?
We'll have updated numbers by then.
Okay.
Yep.
3 o'clock is a little better than 3:30.
Okay, I can do 3 o'clock.
Yeah.
So next week, Tuesday at 3 o'clock.
Great.
And other than that, we'll be 3:30 on Monday. Okay. Very good. Anything else, Mr. Cowan?
No, just thank you for getting me on the agenda today and for your
Thank
time.
Mr. Farrar?
Oh, good, thank you. Put it down.
Yeah, great.
Okay, great. We're adjourned. Thank you.